It is never too early nor too late to start working towards being the healthiest you. Good evening, dear viewers. Welcome to BMC Global Live Hilal Health World. Nothing but lifestyle. This is an exclusive health talk with doctors from Hilal Hospital and Medical Center. Our topic for today's discussion in this 53rd episode of Health World is Vitamin D, Health and Disease. Definitely, it is a frequently asked for topic in health discussions. We will be discussing various aspects why vitamin D is important for our body and how it is related to different health conditions. And I am very happy to welcome the doctor joining with us today, Dr. Rajaneesh Kumar, internal medicine specialist. He has completed MBBS from Calicut, MD from Bangalore, and has done fellowship in intensive care medicine. He has an medical experience of more than 22 years in various hospitals in India and abroad. He is currently working at Al Hilal Hospital, Mohrak branch. So let us move ahead with the discussion regarding vitamin D. Good evening, doctor.
Good evening.
Welcome to Health World episode.
Thank you.
Thank you for joining with us, doctor. So doctor, let us begin with the discussion. Firstly, can you give us an introduction to vitamin D?
Yeah, vitamin D is one of the four fat-soluble vitamins we need, like vitamin A, D, E, K. Vitamin D is a group of fat-soluble vitamins which is having the cholesterol backbone. The other vitamin D, it includes ergocalciferol or D2. Vitamin D3 is cholecalciferol, and the other forms are 25 vitamin D, 25 hydroxy vitamin D, 125 hydroxy vitamin D. These are produced in the body from the cholecalciferol. The active form is calcitriol, which is produced from the kidney. The storage form is 25 hydroxy cholecalciferol, which is produced by the liver. It is stored in the liver.
Okay, so doctor, you introduced us to vitamin D. So how does vitamin D work in our body?
Actually, the active storage form is, as I told, it's 25 hydroxy cholecalciferol, 25 hydroxy vitamin D, and the active form is 125. When we consume ergocalciferol or cholecalciferol, it is converted to 25 hydroxy in the liver, and kidneys, it's converting it to the 125 hydroxy. This is the active form or calcitriol. It is acting on in the intestine and kidney, and it increases the serum calcium. In the intestine, it acts to increase the absorption of calcium, and kidney, it increases the reabsorption of calcium, and it acts in the bone also. When there is low calcium in the blood, it takes calcium from the bone. These are the skeletal, and there are various other extraskeletal actions also, like in the brain. That will come later.
Okay. So doctor, you mentioned about few functions of vitamin D in our body. So what are the different sources from which we can get vitamin D?
Main source is sunlight.
Yes.
Most of us, as you know, the UVB light, from UVB light, ultraviolet B light, we can get, most of us can get some quantity of vitamin. And other sources are like seafoods, like mainly fish, mackerel, tuna, all those we can get, and some minor quantity from milk and fortified food, and beef liver, all those contains cholecalciferol. And coming to the plants, UV exposed plants, mushroom is containing ergocalciferol.
So doctor, you spoke about the sources of vitamin D. Now we generally test vitamin D levels in our blood using blood tests. So what are the optimal levels or the required level of vitamin D in our blood?
When we are testing testing the 25 hydroxy cholecalciferol. Optimal levels are any value above 30 nanomoles per liter is considered to be deficient. It can cause osteomalacia in the adults and rickets in children. 30 to 50 nanomoles per liter is supposed to be insufficient. It may not produce direct effects, but long-term side effects are rather than skeletal and extraskeletal side effects can be there. And the optimal, anything above 50 to 100 is okay. Optimal value will be 75. and above 100 it's considered to be toxic.
Okay. So, doctor, vitamin D deficiency is something that concerns many people. Actually, nowadays, many people complain of vitamin D deficiency. So, what could be the causes of that?
Primary cause is lack of exposure to sun. Second is dietary, lack of consumption of vitamin D food.
Okay.
Then any problem with the liver. Even if the person is consuming vitamin D, it won't be converted to the active form.
Okay.
And any problem with the intestine, malabsorption syndrome, fat malabsorption. Even if he is consuming, it won't be absorbed.
Okay.
Any problem with the kidneys, renal problems, vitamin D won't be converted to the active form.
Okay.
And some medicines, anti-epileptic medications, it interfere with the metabolism of vitamin D, and it's degraded in the body.
Okay.
And some surgeries like a gastric bypass surgery, it also interfere with absorption of the vitamin D.
Okay. So, doctor, vitamin D deficiency, when should we suspect if we have such a deficiency? What are the symptoms generally shown by patients?
Normally, if it depends on the duration and severity of the deficiency.
Okay.
The patient, normally the short duration and mild cases, there won't be any symptoms. If the patient is having 30 to 50, there won't be any symptoms. With long duration and severe deficiency below 30, patient will have muscle pain, bone pain, and because of that, the calcium will be low and PTH will be activated, so there will be bone loss. The patient will have a bone pain, walking difficulty, which is leading to this osteomalacia and osteoporosis.
Okay.
And in children, the rickets also happens.
Okay. Doctor, next I would like to pick up a question which we received in our 24/7 helpline number. So the question is, getting sunlight is one of the sources of vitamin D. As you said earlier, we know of that source. So how much of sunlight daily is required to produce sufficient vitamin D in our body, and is sunlight alone sufficient?
Sunlight alone may not be sufficient, it depends. Sunlight, usually the ideal time is 10 a.m. to 4 p.m. That is the time when you get maximum UVB rays.
Okay.
Also, the other factors depending are the cloud. If there is cloud and the season, winter season, sunlight may not be effective.
Yes.
And the color of the person. If the person is dark colored, he may not produce sufficient. Even if he is exposed to 5 to 30 minutes is the ideal recommendation.
Okay.
Once in every day or alternate day.
Okay.
5 to 30 minutes with legs and upper and lower limbs exposed and face exposed.
Okay.
But even then, he may not produce sufficient quantity. And if the patient is obese, fat person, he may not produce adequate. Ideal recommendation is 5 to 30 minutes.
Okay. Daily 5 to 30 minutes.
5 to 30 minutes.
Okay.
He should not get sunburn also.
Yes.
We have to take care of that.
True.
So some authorities recommend not to overexpose because it increases the chance of skin cancer.
Okay. Okay.
So, and another artificial method is skin tanning.
Okay.
That is a 2 to 6% UVB rays using the artificial method.
Okay.
UV skin tanning chambers are there. That is also one recommendation instead of artificial sunlight.
So thank you, doctor, for that answer. I hope that answers the query that came in our helpline number. Definitely do save our helpline number if you haven't saved yet. We'll be back after a very short break. Stay tuned. We do have further questions regarding how vitamin D is linked to various health conditions. So reminding you again to save our helpline number and do put in your queries for the next episode. We'll be back after a very short break.
All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables. Sweets and snacks, ready-to-eat foods. Dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
Welcome back. You're watching BMC Global Live Hilal Health World. Nothing but lifestyle. Our discussion today is on the topic vitamin D. We covered the basic aspects of vitamin D, the vitamin D deficiency causes, symptoms, and the importance of vitamin D. We will move ahead with further queries regarding how vitamin D can be related to different other diseases. So, doctor, my next question is vitamin D, does it have any relationship with any other cardiovascular diseases?
There is a relation. Okay. Vitamin D is related to the renin-angiotensin system, which controls the blood pressure. It is having a relation with endothelial dysfunction. Okay. So, vitamin D deficiency can lead to endothelial dysfunction, left ventricular hypertrophy. It can increase the cholesterol levels. All these lead to increased cardiovascular diseases, and there is a chance of increased cardiovascular diseases like heart attack, stroke, all these things. There is one study, it shows increase in the vitamin D from the deficient level by 25 decreases the cardiovascular mortality by 10%. Okay. By 25 nanomoles per liter, if you are increasing, the risk decreases by 10%.
Okay. So it is very much important for the heart as well. Yeah. Okay, doctor, immunity is something that is discussed very often these days regarding how to fight various infections, even the COVID infection. So, how does vitamin D have a role in building our immunity or fighting various infections?
Vitamin D activates the immune system, both innate and adaptive immunity. Okay. And in bacterial infection, it activates the macrophages and helps in TB infections and other bacterial infections. Okay. So there is less chance of tuberculosis in vitamin D sufficient patients. Whereas in viral infections, it has immunomodulatory and it decreases the cytokine storm in COVID. Okay. There are so many studies, the patient having 80 vitamin D level of 80, the positivity rate was low, COVID positivity, and those who are a sufficient level of vitamin D, they are having less complications and death rate was also low. Okay. It is due to the immunomodulatory effects of the vitamin D, and it's producing pro-inflammatory factors in the body.
Okay. Doctor, in one of the previous questions you mentioned about obese people, how the absorption of sunlight can be affected. So what is the relationship between vitamin D and obesity actually?
Obesity itself is a risk factor for vitamin D deficiency, because sunlight, even the sunlight exposure, it sequestrates the vitamin D, and also there is a distribution of the vitamin D is distributed in the fat. So already there is vitamin D deficiency. So vitamin D deficiency again in turn causes further obesity. Okay. It's difficult to lose weight when there is vitamin D deficiency. Once you correct the vitamin D deficiency, it's easier to gain muscle mass and lose fat.
Okay. So, doctor, another question is, what is the role of vitamin D in our nervous system?
Nervous system, there are vitamin D receptors in the brain. Okay. So vitamin D deficiency is linked with depression and mood disorders, and most important is multiple sclerosis. There are various studies were conducted. There was a strong relation between vitamin D deficiency and onset of multiple sclerosis, and even after onset and recovery, also after correction of vitamin D deficiency, recovery was better with vitamin D.
Doctor, another concern, another chronic disease commonly found is diabetes. What can be the role or the relation between vitamin D and diabetes?
Yeah, vitamin D increases insulin sensitivity in the liver and muscles.
Okay.
Also, vitamin D increases insulin secretion in the pancreas. So overall, it decreases the chances of diabetes. Same like it decreases the chance of obesity. It's helpful in diabetes also.
Okay. And another common concern found is the thyroid disease. Is there any relation for vitamin D with thyroid disease?
Vitamin D is useful in autoimmune diseases because it is an anti-inflammatory. It's related with Hashimoto's thyroiditis and early Graves' disease. There is a relation between vitamin D deficiency and autoimmune disease.
Okay.
There is high relation between Hashimoto's.
Doctor, how do you recommend vitamin D in the current situation, in the COVID situation, COVID pandemic, the importance of vitamin D?
Most of the agencies, they are recommending vitamin D to keep at a higher level or optimal level for respiratory health as well as for prevention as well as treatment also. Even national guidelines are recommending vitamin D, even if you are COVID positive or negative. Because the positivity rate is also low and the recovery rate is also better with the vitamin D. So consult your doctor and get the optimal vitamin D level.
Yes, so it is very much important in present time, more than ever.
For the immunity.
Yes. Doctor, even cancer is another burning issue of this time. Is there any relation, if I have to ask?
Because there was extensive study was conducted related to colorectal cancer. There was a study was conducted with around 5,000-6,000 people. They were followed up for a period of 5 to 10 years. And it was found 31% increased cancer risk in vitamin deficient people.
Okay.
And those who were having optimal vitamin D, there was improvement of 17% lesser risk was there. And other cancers, not that much association was not proved, but colorectal cancer and other things, it's very strong evidence is there.
Okay. Doctor, right now you mentioned many diseases or health conditions that can be related to vitamin D. You mentioned how important it is and the deficiency should be tackled soon, I suppose. So what is your final advice to the viewers watching us now?
Yeah, you go for a vitamin D test and seek your doctor's opinion.
Yes.
And do supplement. Vitamin D you cannot take like B complex because it is stored in the body. You can go for toxicity. So always check before you take. And the optimum dose depends. You cannot take a universal dose. Dose depends upon your body weight, fat content in the body. That is the thing.
So if there is a vitamin deficiency, we have to definitely treat it medically. Okay. Thank you very much, doctor, for answering to all our queries and telling us about the link between various health diseases and vitamin D. I definitely hope this episode has been a very useful one for all of you viewers. Next week, we will be back Tuesday 8 p.m. with yet another very relevant topic for this month particularly, breast cancer awareness. We will be joining with Dr. Rajaneesh Ramachandran. So definitely save our helpline number and do send in your queries, which will be answered in that episode. So until we meet next week, this is Mareena Francis signing off, reminding you once again, sunlight is one of the best medicines. So make use of it. So see you next week. Good night.
All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry. Our story, our pride.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
വിഷമിക്കണ്ട, എല്ലാം ശരിയാവും.
Lulu Money. സ്നേഹപൂർവ്വം.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909-6845, 3909-4806, 3885-2397, or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.